So 57 minutes from now at 4 p.m., India will start registration for Vaccination 3.0. Now, there are teething troubles, there are niggles. The nation will face some of these in Vaccination 3.0. We get you a ground report on preparations and the troubles ahead.
India set to kickstart vaccine for all, but the drive threatens to spill into a delayed and chaotic affair, at least for some. With vaccine supplies still not up to the mark, those aspiring for quick jabs to beat COVID may have to wait a little longer. There are huge queues already to get vaccines, with mainly those above 45 years, including senior citizens, waiting. Nerves are often frayed as the endless wait upsets people.
The centre has run out of stocks of the vaccine.
वैक्सीन जो दिया है उन्होंने फर्स्ट डोज के बाद उन्होंने देना चाहिए ना कि सेकंड डोज के लिए आ जाइए ये सबको बुला रहे हैं यहाँ पर.
People on ground zero are complaining that they were not given any messages to apprise them of the situation.
There are people waiting to get the first dose of the vaccine.
I've been waiting for half an hour around. I was there.
The system is very slow.
These are the crowds here of the people, some waiting for the first dose and those who are coming in for the second dose of vaccine are being let in.
States and private hospitals are supposed to book vaccines for 18+ category. Things don't look promising, with the centre now advising states not to use its free jabs to inoculate 18+. The letter from the Health Ministry says that states should use free central jabs only for priority groups. Several states, mainly Congress-ruled states, say that vaccine makers are still non-committal on doses and dates.
सीरम इंस्टीट्यूट से हमारे अधिकारियों ने बात की. उन्होंने ये कहा कि भारत सरकार ने जो पहले के हमको ऑर्डर्स दे रखे हैं 15 मई तक तो हम उन ऑर्डर्स को ही पूरा नहीं कर पाएंगे. तो अब हमारे सामने सवाल ये रहा 1 मई से जो 18 साल से 45 साल के 3 करोड़ 13 लाख लोग हैं हमारे, उनको कैसे वैक्सीनेट करें.
2400 rupees per person for vaccination of Bharat Biotech or 1200 rupees per person for vaccination of the vaccine of Serum Institute of India. Can such brazen profiteering be permitted at all? These are questions that Prime Minister needs to answer.
Vaccine makers on their part are hopeful of meeting the surging demand.
50% of our capacities can be sold to state governments and to private hospitals. Now, with limited supply and our obligations that we have to continue giving to the central government, there will be initially very limited supplies. It is a welcome move because of the opening of this market. People can access this in a way that they could not access it earlier. And in the middle to end of May, where you will see these doses being sent out, to private hospitals and to the state governments. So that's where we are at the moment.
All indications point to a not so smooth rollout of the vaccine for all. But things may fall into place as Indian vaccine makers augment supplies and foreign jabs like Sputnik start arriving.
India will start getting the Sputnik V supplies from Russia in May. These will be initial and limited quantities, which will ramp up over the next 2 to 3 months. There are 2 routes by which the quantities would come into India. One is through the product that's manufactured in Russia and imported into the country. The second is through local manufacturing, which we will also be starting in the next couple of months to start delivering the vaccines from the India-made product.
Till enough vaccine shots arrive, masks, distancing and hand hygiene remains our best bet. With Sneha Murdani, Bureau Report, India Today.
So from the 1st of May, vaccination for all is being announced. But look at the road ahead. You heard both Adar Poonawala of Serum Institute of India in conversations with Rahul Kanwal, and also the manufacturers of Sputnik V at Dr. Reddy's lab. And what are they saying? It will ramp up, but it will ramp up in May, June and July. So what happens on the 1st of May? As of now, there's Bharat Biotech and Serum Institute. Sputnik will come in, but in numbers only end May, early June and July. Sneha Murdani now decodes the vaccine policy and the road ahead.
Let's take a look at this new vaccine policy. We're going to try and decode it for you. All imported jabs are only for states and private hospitals. So these the imported jabs will be given to states and private hospitals. 50% of the jabs for center, rest for states and private hospitals. This is what the Union Health Ministry, in fact, decided in consultation with the various panels. The centers, free doses to states only for priority groups. So the center says that we have about 1 crore doses that we've already given, and we're going to be giving 57 lakh more in the next 3 days or so, but do not use them for those above the age of 18. Use them only for the priority groups. The state with more infection to ideally be getting more vaccines, well, that is something that is being looked at as well. States speeding up jabs will get more vaccines. So the more you use, the more you consume, obviously, the more the state is going to be in a position to ask then the center to provide, because the state is going to get at least 50% of the vaccine still from this center, in spite of having its own dealings also with these two companies that right now are manufacturing the doses for India. States wasting vaccines may get fewer jabs, and the center has drawn up a list of some of these states who are wasting the jabs, not utilizing the vials well when the vials are opened. Vaccines for priority groups to be prioritized. The center has maintained that still our focus is going to be on the priority groups. So sure, go ahead, vaccinate those above the age of 18, but do that using the jabs that you have procured directly from these two manufacturing companies. The center to periodically review the vaccine policy. It's been doing so time and again from the time this drive actually started, and in fact on the 16th of January early this year.
Is there eager anticipation? Is there apprehension? Let me quickly take it to ground zero. Abhishek Mishra joins us from Lucknow and Saurabh Aktania joins us from Mumbai. And Saurabh, you've been on ground covering the vaccination drive, and almost all doctors are saying get vaccinated as quickly as possible. It saves lives. Saurabh, what's the situation on ground right now?
Well, absolutely, Gaurav. We have to register ourselves. We have been working on ground since over past 1 year. We are on the front line getting you all the story. So we on India Today clearly appeal to all the citizens that who all are eligible, we should get registered. And in fact, even myself, Gaurav, as the clock ticks at 4, I will also get myself registered. Now, the big decision has been come from the state of Maharashtra. Just now the cabinet meeting is going on and it has been decided. The CM Uddhav Thackeray has said in this cabinet meeting that from the age group from 18 to 14, everyone in Maharashtra will be getting free vaccine. But let me tell you, where are we going to get these vaccines? Because in Mumbai today, Gaurav, most of the vaccination centers are shut down. We saw huge queues wherein senior citizens were lined up outside the vaccination centers, but all were in dry. So what the state government is right now saying that they have written to the Serum Institute and the Biotech. They are asking for more vaccines, but still they have yet to get any reply from them. Now what they are going is another option is that they have issued a global tender. They are saying that whether they can also import some vaccine from foreign countries. So all these things are right now been discussed. Most importantly, Gaurav, we spoke to many of the private hospitals, some of the government hospitals as well. They are saying that it is very unlikely that the vaccination drive starts from May 1. It will take few days time till the time they get the stock, they build such infrastructure, and only then the vaccination drives will start. As far as Mumbai is concerned, BMC Commissioner told India Today just few minutes back that they are going to set up over 225 vaccinator centers in whole of Mumbai. That is almost all the wards will have their separate vaccination center. So it's a big decision. So they are building up the infrastructure as in and when they get the vaccines.
Stay with me because Maharashtra is very concerned.
India Today are appealing.
Yes.
More and more people should register.
More and more people should register, no doubt. But in about 47 minutes from now, there'll be clarity. Will Maharashtra have enough vaccines? And is that also an issue in the most populous state in Uttar Pradesh? Abhishek, are people looking forward to getting registered? Because COVID cases are on the rise, though Chief Minister Yogi Adityanath insists that Uttar Pradesh has adequate number of beds, medicines and oxygen. What's the situation on ground? Is there enthusiasm about getting the jab? People between 18 and 45?
Well, absolutely, Gaurav. As far as vaccination is concerned, people in Uttar Pradesh, specifically the young lot, they're quite excited. They have been waiting for this opportunity. And when the government announced that 18 plus people will now be getting their jabs from 1st May onwards, they were hoping to get registered as soon as possible, because there is a condition that they need to pre-register. There won't be much of a walk-in vaccination. So that's the priority. And we have met with many youngsters, and they're saying that, at sharp 4, they are going to register for it, and they want to get vaccinated as soon as possible. But at the same time, if you talk about the claims of the government, the Yogi government, yes, indeed, is saying that there are no scarcity of the beds, oxygen supply is smooth, but on ground things are still not stable. We've encountered with many families members who are rushing for the beds, and at the same time scarcity of oxygen. Although Yogi Adityanath, CM, has given instruction to fulfill this as soon as possible, there is a committee which is strictly monitoring helpline numbers, which have been said that they are working 24 hours, but there still needs to be done more. And as far as vaccination is concerned, the primary concern would be the sufficient supply of vaccination. Currently, UP is having 15 lakh doses, and they plan to give about 6.5 lakh average vaccination per day from May 1st onwards. So that's going to be challenging, although the officials are saying that they are getting the vaccine in regular interval of time. But that remains to be seen what will be the impact from May 1st. But as far as preparations are concerned,
yes,
UP government aims at vaccinating in the month of May around 1.5 crore people. That's going to be a big challenge with the fact how the system is existing currently in Uttar Pradesh.
Oh, yes, absolutely. Uttar Pradesh was the first state to announce free vaccination for all above the age of 18 at government hospitals. Several other states have now done that. Now, ahead of this universal vaccination drive, excuse me, vaccination centers in Mumbai are already saying they're running low on stocks. For example, Mumbai's BKC Jumbo Vaccination Center has shut down because they don't have vaccines. BMC vaccination centers, they are going to be conducting the vaccination drive and registration that starts in 44 minutes from now on the 28th of April.
We are outside the BKC Jumbo Vaccination Center in Mumbai. This vaccination center is not working today because the center has run out of stocks of the vaccine. But then have a look around, the helpless citizens asking the doctors, asking the policemen as to when they should be coming to get the vaccine.
इसने वैक्सीन जो दिया है उन्होंने फर्स्ट डोज के बाद उन्होंने देना चाहिए ना कि सेकंड डोज के लिए आ जाइए. ये सबको बुला रहे हैं यहाँ पर, तो कैसे मिलेगा? फर्स्ट डोज भी नहीं, सेकंड डोज भी नहीं मिल रहा है पब्लिक को.
कोई मैसेज वगैरह आया?
सेकंड डोज के लिए आया था 2 तारीख को कि वैक्सीन नहीं है, खत्म हो गया है.
फर्स्ट डोज लिया था, वहाँ पे नहीं था, तो हम यहाँ आए. यहाँ भी नहीं है, अब वापस घर जाएंगे.
वहाँ पे भी बंद है, फिर यहाँ पे आए.
यहाँ पे इतनी परेशानियाँ हो रही हैं आपको?
बहुत बहुत परेशानी हो रही है, और घुटनों में इतना पेन है, चल चल के भाग के आना पड़ता है.
Today, only 75 vaccination centers of the total lot of 136 are working. BKC Jumbo Center, as the signboard here says, that we are out of stock, vaccine is not available, and sorry for inconvenience. Helpline numbers have been placed here, but then people on ground zero are complaining that they were not given any messages. Phone calls were not made to apprise them of the situation, and most of them, as they say, were not aware at all that the vaccine at this particular center had run out of stock. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
क्योंकि फर्स्ट मे के बाद अगेन द डिमांड विल इंक्रीज, द पीपल विल वॉक इन, और फिर वही दिक्कत आएगी कि सप्लाई पीछे से शॉर्ट होगा मेरे साथ. वो नॉट अवेलेबल, दे वर सेइंग हमारे पास इतनी डोजेज हैं, आपको सपोज वी जस्ट हैव 100 डोजेज, हम आपको 200 डोजेज देंगे, 100 डोजेज देंगे. और उस टाइम पे 200 डोज दिन की लग रही थी, तो अगर मुझे 200 डोज भी मिल रही हैं तो उस दिन लग के खत्म, नेक्स्ट डे के लिए मेरे पास है ही नहीं.
Private, how many number that you are looking at, private hospitals and other health centers?
See, private, now the choice, not the just 2 vaccines, there will be choice of many vaccines. So it is a choice of the people, whoever wants to opt for any kind of vaccination, it will be available. Whatever has been, yes, private hospital, they can give it in open market. Even the open market is open, available in the open market for them to avail and provide the vaccination, so that parallelly along with the government, whoever is interested, there are many people, many companies, many affordable people, whoever wants to make use of the opportunity. So no restriction that it should be only limited to government. We are allowing all the private players and the open market to make the best opportunity and mobilize from wherever they can get vaccination across the world and vaccinate the people parallelly.
So final question, sir, has the government already ordered for the vaccine as the procurement process began?
Yeah, definitely we ordered 10 days back itself. We didn't want to delay because many of the states parallelly, they are also trying to procure the vaccination. We didn't want to delay anything. Without waiting or delay, we ordered and we placed the orders. And formally, we are just processing the order.
Sir, it's a fantastic initiative actually. It should have been done earlier itself. The thing is, then we would have not faced these extremities. So I think I have already registered for this vaccination drive, and we are looking forward for the vaccination.
Great idea, because they would have been given it much earlier than now, because now we can see that lots of people are suffering, and then it's spreading and it's very contagious. And I've been register for this, and then I request everybody to register for this and then take the benefit of it.
गुजरात में जिस तरीके से कोरोना के मामलों में दिन ब दिन बढ़ोतरी हो रही है, वैसे में अस्पतालों के अंदर ना तो लोगों को बेड मिल पा रहा है और ना ही ऑक्सीजन सिलेंडर। वैसे में कोरोना से बचने का एक ही जरिया है और वो है वैक्सीनेशन। आप यहाँ पे देख सकते हैं कि ज़्यादा से ज़्यादा लोग अब वैक्सीनेशन के लिए यहाँ पे पहुँच रहे हैं। जिस तरीके से कोरोना के मामलों में लगातार बढ़ोतरी हो रही है, लगातार लोगों के जो मौत के आंकड़े हैं वो सामने आ रहे हैं, तो वैसे में लोग जो है वो भी अब क्योंकि एक तरीके से हम कह सकते हैं कि लोगों के जहन में डर है, अगर कोरोना होता है तो मौत भी हो सकती है। वैसे में लगातार जो लोग हैं वो अब ये मान चुके हैं कि अगर वैक्सीन लगवा लेंगे तो कम से कम मौत तो नहीं ही होगी। वैसे में यहाँ पे ज़्यादा से ज़्यादा लोग अब वैक्सीनेशन के लिए पहुँच रहे हैं।
In 2020, we saw horrifying images of migrants walking down, cycling down, going away from the workplace. But shift to 2021, things are changing because of the vaccination drive. A joint collaboration between the police, the medical teams and the industrialists to ensure that those who are eligible are vaccinated. The next big drive will be May 1st, where 18 and above are going to be eligible, to ensure that each and every labour is vaccinated, to ensure the industry in Ludhiana is back on its feet. With camera person Sachin Chandok, this is Kamaljeet Sandhu in Ludhiana for India Today.
So as the nation looks forward to the vaccination drive, the national capital continues to struggle to meet the oxygen requirement and of course the shortage of hospital beds. There is an unending surge in cases coming down heavily on the Arvind Kejriwal government. The Delhi High Court asked the state government to either mend its ways, improve its performance or let the centre take over oxygen supply. This as the city witnessed ugly scenes of doctors and healthcare workers being attacked by angry relatives of COVID victims. Nalini Sharma brings us this report.
Anger over Delhi's COVID emergency spills over. This is Indraprastha Apollo Hospital in Sarita Vihar, where the families of patients went on a rampage over the non-availability of ICU beds. Doctors and nurses, the frontline warriors against coronavirus, became victims of the fury. Across the national capital, stories of misery, pain, helplessness are playing out. Delhi is out of hospital beds, almost out of ICU beds and ventilators, and is struggling to fix oxygen supplies. A 500-bed COVID care facility opened by the ITBP is fully occupied in just a day. The shortage is such, COVID-19 patients are fleeing the capital to neighboring states in order to get ICU beds.
दिल्ली में इतनी बुरी हालत है, किसी भी हॉस्पिटल में एक बेड तक नहीं है। मेरे फादर की हालत इतनी बुरी थी, ऑक्सीजन लेवल बहुत कम जा रहा था, लेकिन उन लोगों ने बेड तक नहीं दिया, जिस वजह से हमें रातों रात एम्बुलेंस करके इधर आना पड़ा किसी के थ्रू।
While the oxygen crisis continues unresolved, help is coming. Delhi received its first oxygen express. Indian Railways have ferried 70 metric tons of the life-saving gas from Chhattisgarh. Meanwhile, the ruling Aam Aadmi Party faced some tough questions in the High Court on Tuesday. The High Court pulled up the Delhi government saying, if you are not able to manage your house, tell us. We will ask the central government to take over immediately. It has also taken serious note of the state government's decision to convert Ashoka Hotel into a COVID facility for judges. Amid rising cases in Delhi, testing and vaccination figures have dropped by 50% from the level 15 days ago. It's not clear if these are down due to any shortage of vaccines and testing kits. Bureau Report, India Today.
Now, efforts are being made to ensure that Delhi gets more oxygen. But where are the niggles? Where are the problems? India Today's Sneha Murdani brings us details about the oxygen status and the states that are supplying oxygen to the national capital.
Well, Delhi is in news for all the wrong reasons because hospitals here are running out of oxygen, and we have horrific stories of various hospitals running out of oxygen. But let's get you an idea about where the national capital essentially gets its oxygen from. The first source, Panipat, the company which is giving oxygen about 140 metric tons approximately, is Air Liquide in Panipat. In Barotiwala, there is a company called Inox, which is about 300 kilometers away from Delhi, supplying 20 metric tons of oxygen to the national capital. In Rourkela, we have a company by the name of Lindi, which is supplying about 40 metric tons of oxygen to the national capital. Kali Ganga Nagar, where 30 metric tons of oxygen has been supplied to Delhi from a plant called Lindi again. In Bhiwani, there, again, the plant is Inox, and 20 metric tons of oxygen is coming in from here. In Ghaziabad, the plant is Goel MG Gases. About 30 metric tons of oxygen given to Delhi from here again. Surajpur again has a plant, the Inox plant, giving 35 metric tons of oxygen to Delhi. Modinagar, there, the Inox plant is supplying 30 metric tons of oxygen to the national capital. Kashipur again, via its plant, India Glycols Limited, supplying 30 metric tons of oxygen to the national capital. Roorkee, the Air Liquide plant, supplying 20 metric tons of oxygen to Delhi. Durgapur, the plant, Lindi, also giving oxygen about 30 metric tons to Delhi. And this, of course, is the source of oxygen from different parts of the country to the national capital.
And from the national capital, I want to take you to Uttar Pradesh. For the 6th straight day, Uttar Pradesh has recorded more than 30,000 infections in 24 hours. In the past 24 hours, Uttar Pradesh saw 32,993 new cases. 4,400 are from capital Lucknow alone. What turns out to be a major cause for concern is the spike in death toll. 265 deaths reported in the past 24 hours, which is the highest in a single day in UP. Of course, there is massive outrage over CMO officials threatening relatives of COVID patients seeking remdesivir in Noida, adjoining Delhi. The chief medical officer and officials around virtually threatening kin with jail if they return to office seeking oxygen or seeking remdesivir.
सेमो क्या कह रहे हैं? आप लोग किस लिए आए हैं? क्या कह रहे हैं?
हाँ, बोल रहे कि अवेलेबल होगा तो देंगे। हमने कहा फिर दोबारा आएंगे तो बोल रहे कि जेल में डलवाने के लिए।
जेल में क्यों डलवा देंगे?
इंजेक्शन दोबारा आएंगे लेने के लिए।
तो इंजेक्शन दिया उन्होंने? नहीं दिया।
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.